Recording started. This is Martin Giles of the Guildford Dragon News, and I've been joined by Louise Stead, who's the Chief Executive Officer at the Royal Surrey County Hospital. Louise, thank you very much for giving your time to the Guildford Dragon for this interview today.
My pleasure, Martin. Nice to speak to you.
Okay, I'm not going to waste time, so straight into it. Obviously, wave 2 of the pandemic is probably proving to be worse than we feared, partially because of the extra infectiousness of the new variant. What is the level of COVID-related activity at the Royal Surrey at the moment? In percentage terms, how much spare capacity do you have?
So about 20% of our beds are currently full of COVID patients. We are obviously trying to limit the patients we have coming into the hospital by reducing things like outpatients and making those all virtual. From a point of view of intensive care, which is, I suppose, the piece that's getting all the news around the country, yes. We initially started with sort of 14 ITU beds. We're currently up at 23 ITU beds, with a plan to expand to some more over the coming weeks. So we are absolutely being mindful of the need to expand those beds and to manage our patients. We have patients in other wards that are having what we call non-invasive ventilation or CPAP, which is what people have probably heard on the news. So the intensive care is really widened out, and some of those patients are being looked after on general wards, which we are focusing just on patients who need that CPAP or non-invasive ventilation.
Okay, and how important has the Guildford ward proved to be? I presume it is being utilised.
Oh, it's been an absolute lifesaver, Martin, to be honest with you. It's complete. I think we've got one empty cubicle this afternoon, but that will be full by the end of the day. So, you know, they're all individual rooms. They've all got negative pressure. So that gives you extra infection control capability. So yes, it's been an absolute, it's a wonderful facility. And actually the comments we're getting from patients who've been nursed there are so positive, because they do realise that they are in a facility that is coping with respiratory diseases really well.
Obviously, a really worthwhile investment then.
Yeah, absolutely.
We have had reports that some patients have been transferred in from other parts of the country, especially Kent. Can you confirm that?
So yes, we have taken mutual aid from patients across the southeast, from within Surrey Heartlands and from surrounding counties, yes.
But presumably that's just completely normal in a situation like this to help out with other areas where we can.
Yes, absolutely, and I'm sure that if the same happens as we see the spike of the disease sort of sweeping across the country from right to left, I'm sure exactly the same would be enacted if we needed some mutual aid as well.
Yes. Now, taking into account the lag time that we're aware of between infection and the outcome, deaths do appear to have risen, deaths do not appear to have risen in proportion to the raised infection levels this time, in the same proportion as they did last time. Is that your observation too? And if so, why?
So yeah, I think that is a national observation, and I think really we're just better at knowing how to treat these patients this time. We've got better testing, people are coming forward earlier, and I think that we've got new drug regimes, and I know some new ones have been announced yesterday, which I'm afraid I don't know the details of, so I can't tell you about those. But even the use of dextromethasone when we've got patients who are requiring oxygen therapy, that does seem to be making a massive difference to outcomes.
Okay, so the treatments have been refined with experience.
That's right.
And presumably lessons learned across the different hospitals.
Yes, absolutely. And I think, you know, we every area has taken the learning from last time and really honed that down. So I think we are definitely better prepared this time.
Great. So what about the current rules for hospital visitors? I suspect there's some concern about that, and perhaps not everyone understands what the rules are at the moment.
Yes, so we have continued to limit visiting really to end-of-life care. That's the only exception. We are still trying to support visiting within maternity areas because we know how important it is for bonding for families to be there when baby's born. But of course, the biggest thing we've got to do is to try and protect our patients and our staff. And the less footfall you have through the hospital, the better it is. And I think I was walking around the wards on Christmas Day, and on every single ward we said, have you supported visiting for end-of-life care patients? And the answer was yes on every ward. So we are trying to do the very best we can for patients while making sure that we don't put anybody else at risk.
Well, I'm sure a lot of people will understand that requirement and also appreciate the exclusion for end-of-life visits there. Now, how safe would you say it is in the hospital for those who are attending for non-COVID treatment? I suspect quite a lot are nervous about that. In fact, there have been reports that that is the case.
Well, I think it's understandable that people are nervous. I think that we are checking everybody who comes to the doors, making sure we know where their appointment is, giving them the very quickest way to get to their appointment, or advising them to come to the door that is closest to where their appointment is. We're asking everybody to wear masks. We're trying to make sure that people have the shortest waiting time they can if they're coming on site for an appointment. So, we're putting telephone clinics in between telephone appointments in between actual appointments to make sure that you aren't having many people waiting at the same time. I think we've made it as safe as we possibly can. And, you stand still for a moment and you'll be wiped down with an alcohol rub. So, I think that we are, with the whole place, we've increased the amount of cleaning we've got. So as far as we can do, we are making sure that everybody is completely safe. The patients coming in for planned surgery, where they are staying overnight, they are going through a green pathway. That means that they are tested for COVID before they come in. It also means that we're testing all our staff using lateral flow tests twice a week. So that gives everybody the best assurance that we are picking up any infections we can and making sure that patients and staff are not exposed.
Okay, now diagnostic testing for non-COVID disease, etc., that has understandably reduced during the pandemic. In fact, at a lower rate at the Royal Surrey than in lots of other countries, lots of other hospitals across the country. But what do you say to those who have noticed suspicious symptoms, nothing to do with COVID, but are worried about being infected at the hospital or in a surgery?
So I think that the most important thing is if you have suspicious symptoms that you do need to go and see somebody about it, go and see your GP. If they feel you need to be referred for a diagnostic test, we are doing everything we can to make our hospital the safest it possibly can be. And I think you need to absolutely make sure you do the right thing for your own health. And that, by wearing a mask, by hand sanitizing, by washing your hands, which is absolutely what we make our staff do, you will be as safe as you possibly can. Okay. Probably safer than being in the supermarket.
Yes, indeed. And probably a key question here, I think, is how is staff morale standing up during this? Because this second wave is proving to be probably worse than the first. I don't know if you agree with that, but police are reporting that their officers are getting a bit weary with it, and I think the population generally is getting weary with this. So how is the morale standing up?
So I think staff are tired. I think that's a fair thing to say. I think that life is pretty stressful in a hospital, but it's pretty stressful if you're at home trying to educate two small children. So, I think that we have at the Royal Surrey a real ethos of trying to pull together and support each other. And I think that goes a long way to really making sure that people do feel that they are doing the best they can when they come to work. And if they feel they need to, stop and go outside for a walk around, people are very supportive about giving them the time they need. We are definitely trying to make the most of our health and well-being. We're trying to make sure we've got spaces for people to have breaks. We've got fresh fruit coming round. We're trying to support our staff, even in small ways, but ways that we can to make things a bit better for them. So I think we are all trying to pull together as much as we can. And I think that's all we can do, is support each other, listen to each other, and just try and work in the best way we can to give the best care for our patients.
And what can our readers and the community generally do to help best support your fight against COVID-19? Do you want them to go out and clap, or do you want them more to concentrate on complying with the rules?
So it's always nice to be appreciated, but I think the most important thing is for people to follow the rules, stay in, stay away from other people. The last thing we want is people standing outside the house and getting freezing cold. So I think, people are doing what they think is the right thing to do to support the local health service. But as long as you're following the national rules, which really is the only way we're going to get through this, stay at home, stay away from other people, wear a face covering.
Louise Stead, thank you very much for that interview. And I'm sure if it were possible to somehow transmit energy into the hospital from the community, surrounding community, we would, because a lot of us are thinking about what's going on there. Well,
thank you very much. It is really, really appreciated. We know, we really appreciate the esteem that the local community holds us in, and we do our best to live up to that.
We certainly do. Thank you very much.
Thank you.